Hey, so in today's video, what I want to talk about is terminal knee extensions. So this is a common exercise that a lot of people use to get the VMO and to drive knee extension. So if you just do a few, so this is the kind of traditional way of doing it, where people are pushing back and again, they're squeezing their quad. Now, I've got a little bit of an issue with that because I think that's driving a very bad pattern that I actually spend the vast majority of my time trying to get people to avoid, okay? So if you look at osteoarthritis kind of patients, a lot of people with knee pain, a lot of people with a lot of lower limb issues, and I go into this a lot and I spend a lot of time, the first hour of my return to play course is actually spent telling people why we should avoid this, and I've got plenty of other videos on that if you want to learn more about that. But to make a long story short, as that foot hits the floor, what we want to discourage is actually the knee snapping back, because there's a lot of disadvantages to the knee snapping back, okay? So when the knee snaps back, the knee joint's doing work, obviously, but what it then does is it puts the glute at a disadvantage. So we're putting the glute max essentially into a passive hip extension. So if the knee's snapping back early, then it's very, very hard for the glute to actually do work. So I spend a lot of time, both with athletes, professional athletes, but also here in the clinic, actually helping people to subconsciously delay any extension. Because if we delay any extension, then the hip can actually do work, okay? Now, don't misunderstand me. There's nothing wrong with knee extension, but when I want knee extension is just like gait, okay? So as I'm running or walking, I want the hip to do a lot of work, okay? Uniarticular muscle, I want that hip to do a lot of work. And then I want the knee to extend, okay? So I am okay with the knee extending, but I want the knee to extend about here. Whereas I think a lot of people, they're giving a very bad stimulus to the brain. There's a lack of coordination happening with this exercise, where you're just basically trying to pump the VMO. I'm a little bit skeptical, if I'm honest, about the carryover to an exercise like that. So a better option, in my opinion, that I would use with an athlete or with a patient is, as that foot hits the floor, okay, I want to be pushing through the foot, okay, as I come through, and then I want the knee to extend here, okay? So an option that we would do is Shane's just going to step forward with his left leg, but the big thing that I'm cueing Shane here is I want his knee extension to be driven from the floor and the foot, okay? Because that's what's going to have to happen subconsciously in real life in the vast majority of tasks that people do. So as you pass through here, Shane, I want good intent. Imagine you're squashing an orange through that midfoot and forefoot as you come through. And what's going to happen is Shane's naturally going to get the knee extension to happen without consciously having to do the movement, okay? When we talk about using this exercise for ACLs, it doesn't quite make sense to me, okay? Because the ACL is heavily reliant on, especially the medial hamstrings, okay? So in this movement here, we're essentially getting the quads to do a lot of work. The hamstrings are doing very, very little. When we go back to this exercise, by pushing through the midfoot and forefoot, we're getting a lot of proximal gastrodistal hamstring to resist knee extension, to allow the hip to do work. When the hips don't work, then the quad can finish the movement. Okay, so I think that's a very, very important differentiation. So Shane's still going to feel a lot of quad, but the intent is through the foot all the time. So we can still drive the knee extension, we can still get the quad to fire, okay, but better still, we're getting the quad to fire while the hip does work, while the hamstring and gastro are also doing work, okay? So if you know anything about my approach, it's a very coordinative approach. I think it's a step before strength, okay? But most importantly, in a very simplistic view, all I want is everything to do its job. I'm not big into isolating muscles. I want everything to be able to do its job in 3 planes of motion and tolerate load, tolerate the body weight. And I think this exercise is a much better choice that's going to tick a lot of those boxes from a coordinative point of view. And I just feel, obviously it's very hard to prove this, but I feel the carryover is much, much better. We use this and we've got a lot of progressions to go from this position. So the key coaching cues here is, as Shane goes, he needs a lot of good intent from that midfoot. The more intent he has from the midfoot and forefoot, the longer he's going to delay knee extension, but there's a nice co-contraction at the knee. So the quad is still firing All the quad muscles are still firing, but they're firing with the hamstring and with the gastro to keep that knee nice and safe. If I have a patient that's walking and we get this knee snapping back, like you see with a lot of OA patients, the knee joint's doing a lot of work. We produce force at the quads. There's a lot of force going down into that knee joint without the hamstring and the gastro helping. Okay? Whereas we do it this way, where we have got good intent through the foot, the midfoot and forefoot, then we're also getting the hamstring and gastro to be active while we're still getting good stimulus from the quad. Okay? It's a very simple change. Okay, but we're getting everything working rather than trying to isolate something that I personally feel it's a very, very bad pattern that I spend a lot of time, the vast majority of my time with lower limb injuries, is I actually spend the vast majority of my time trying to get people moving away from that. And you see this a lot with a lot of exercises when people are doing all these fast exercises, the knee snaps back. If the knee snaps back, then the hip is going to find it very, very hard to do work. If we can delay knee extension, then we're putting the hip in the best possible length tension relationship to actually do work, and then the knee can finish the movement. Okay, so it's just something to consider. Okay, it's a small change that, in my opinion, is going to have a massive impact in your clinical practice. So you can still get what you want. We're just making a small change by looking at the physiology, by looking at movement, by looking at how the brain works, looking at how the brain interacts with the spinal cord and the peripheral tissues. And I just think the value in this exercise, it's a lot greater than just doing terminal knee extensions. So give it a try, see what you think. Let me know in the comments. And as I said, I'd be more than happy to answer any questions.